Right, let's get going. South Africa has recorded 11,535 new COVID-19 cases in the last 24-hour reporting period. Gauteng has again made up the bulk of new infections with 8,280 cases. It follows, or is followed, by the Western Cape and KwaZulu-Natal. A further 44 coronavirus-related deaths have also been reported. The Department of Health is appealing to South Africans once more to get vaccinated in order to reduce the risk of severe illness and death. Well, Gauteng's Coronavirus Command Council has revealed today that hospitalizations are currently lower than compared to the same time in previous waves. The officials, speaking at a briefing today, explained that the Omicron variant is now the dominant strain.
So I want to say just one thing about Omicron. There's been a lot of information in the media. We know that it's now a new variant of concern, and this is what's driving the resurgence in Gauteng. And the most recent report from the NICD and the Genomic Surveillance Network in South Africa that was released yesterday shows that Omicron is now dominant in Gauteng. And if you can look at the graph at the bottom there, it's showing the percentage of all genomes that were sequenced in the last 3 weeks up to 27th November. You can see there the red, okay, I don't have a pointer, the red bars are Omicron. The green bars are Delta. So you can see the week prior to the week 44, which is the week prior, Delta was still fairly dominant in our province. But starting from week 45, 46, 47, we're seeing Omicron as the dominant variant.
Well, the Council's Bruce Millardo says infections in Gauteng are expected to peak in the next 2 weeks.
So what you see in the graph there is that we are going to be seeing a quick, fast rise of numbers still this week and probably the next, and we should peak round about the second week of December. Now, one can argue, well, the peak is coming very fast. It's natural because we have high levels of transmission, but it's very important to bear in mind that a peak of a wave, a peak of a resurgence, is not the end of a resurgence. Because if you see the predictions there, we're going to have high levels of community transmission still into January. So this means that the fact that the peak is coming earlier should not prevent us from going and get vaccinated. We're going to have very large numbers still past the new year in January.
Well, as South Africa grapples with this Omicron variant, which is driving infections, are provinces ready for a fourth wave? Gauteng, just to remind you, currently accounts for more than 70%, or about 70% of overall infections in the country. But with the festive season upon us, people are getting ready to go home and move to other provinces to see loved ones. So should the other provinces, for example, start to put in the work so that when they start to see a peak, it's not one that overwhelms health systems as we've seen in previous waves? To talk about this, I'm joined tonight by the Western Cape's Health MEC, Nomafrench Mbombo, Limpopo's Health MEC, Dr Phophi Ramathuba, the Eastern Cape Health Department, HOD, Dr Rolene Wagner. We also have tonight with us Dr Michelle Groome, the head of the Public Health Service at the National Institute for Communicable Diseases. As ever, you can be part of our discussion. Send us your questions and comments to 072-110-5584 or tweet us at Newzroom405. If you wish to go live on air with us, send us a WhatsApp message and we will ring you right back. Ladies, a very good evening to you all. Welcome to In Focus. If I can begin with you, MEC Mbombo, because there was another update today from the Western Cape saying that you are now officially in a resurgence phase. What does that mean in real terms for the people of the Western Cape?
Thank you. It means that we have got 20% plus in the 7 days rolling average of the cases that have increased. Before the resurgence, we were on the alert, which was less than 20%. And then once we overboard, once after 7 days we remain on this resurgence, that's when now we can define as the fourth wave. So we see the increase in number of, even also day to day in the number of cases, but we are not yet in the fourth wave. But the challenge that we're going to have is about that because most of you are vaccinated, might not see much of the hospitalization because In the previous waves, you have seen the hospitalization, the oxygen utilization, and also the death, which we haven't seen as yet, the increase in number of the deaths and the hospitalization.
And it's interesting that both the Western Cape and Gauteng say that they are in a resurgence, because I'm looking at new infections reported tonight. Gauteng has over 8,000 new cases. In the Western Cape, you have 727. How worried are you that you could see a similar situation in Gauteng? When do you expect that your new cases will go into the thousands?
If indeed, as the prelim data shows, that the Omicron, which is the new variant, might be highly transmissible more than the Delta, it could mean that indeed we could go up to that stage like the Gauteng in regard to the community transmission. With the cases of the variants that have been now detected, there have been 16 that have been detected. However, with the proxy PCR testing, which is you don't have to test the individual, you just use the lab, use the current tests that are already there in terms of the positivity, in regard to the presence of the variant. Already 80% of those tests that have already, like the ones that you are coaching, I think I've got 2,700 plus of the new infections, of the cases where we've got active cases. So it could be up to that level. So that's why we still urge people in regard to the non-pharmaceutical interventions, even if we don't see as many cases that are hospitalized or we've got as many deaths as it has been like in the previous waves.
MEC Phophi Ramathuba, Limpopo, last time I spoke to you, your main concern, especially as far as Omicron is concerned, is that you are a home province to a lot of the people who work in Gauteng, which is the current epicenter. When you look at this steady climb in infections here, how anxious does that make you about the trajectory for Limpopo in the next few weeks?
Good evening, Thembekile, and evening to all your viewers out there. Yes, indeed, we want to reiterate the message we said last week, that as long as we start to see the numbers increasing in Gauteng, the same must be expected in Limpopo. I even further to say every Friday, N1 North, it's full to capacity. On a Sunday, N1 South, back to work, it's full to capacity. You would see that even the 24-hour cases being recorded. When Gauteng doubles, even Limpopo doubles. When Gauteng was at 6,000, today they are at 8,000. We were at 200, today we are at 400. So you can see that the two provinces, we can't separate what is going on the other side. Especially if you look now, our main challenge is the cluster outbreaks within the mining area, where in most of the mine workers also, some of them not necessarily reside in Limpopo, they reside in other parts of the country. They would be coming to work in the province. And interprovincial movement is bound to cause this increment.
Dr. Rolene Wagner, HOD for the Eastern Cape Health Department. You, like Limpopo, are a home province for many people who work in Cape Town, Johannesburg, Pretoria. When you look at the numbers, and you are doing at the moment even better than Limpopo, because the Eastern Cape tonight has recorded just 194 new infections. Do you share the anxiety that Limpopo has?
Good evening, Thembekile, and good evening to your listeners. Yes, we are concerned as well. I think when we not only look at the patterns emerging in other provinces, but even within our own province, 1 week ago we had 156 cases, and today we had around 321 cases. So that's almost double what we had last week. So we're also starting to see this exponential increase. Fortunately, we've analyzed where they're coming from, the districts, and there are some districts which have very low numbers. So Alfred Nzo has 6 active cases, but when we go across to Nelson Mandela Bay, to the Buffalo City, those have higher numbers. And so we are concerned. We've identified particular hotspots. We have track and trace teams now out on the ground to try and identify who the index cases are, identifying all of their contacts, And we've also increased our surveillance, testing, doing so many more tests around and within those hotspots to try and contain those cases that have been identified as positive cases. If we take Alfred Nzo as an example, where we have those 6 cases, when we analyze the 3 index cases, we have also picked up in Alfred Nzo, but also in other districts, that these are people who have come from Gauteng as an example, and people who reside in Gauteng but are coming home now. As you were saying, many people come from the Eastern Cape but live and work in the Western Cape and in Gauteng. So we do have a concern that these numbers are going to increase exponentially, and we need to try and contain as rapidly as we can now whatever infections we are identifying.
And Dr. Michelle Groome from the NICD, let me come to you then. So you've got Gauteng and the Western Cape saying they are firmly now dealing with a resurgence in infections. Limpopo and the Eastern Cape are bracing for a rise in infections as people go home to be with family over Christmas. Is it still too soon to say we are now in the 4th wave as a country?
Well, I think there is the technical definition, I think, which was formulated by the Ministerial Advisory Committee, and I think we were in the process of trying to revise that. And thought we would have some more time before the case numbers started increasing. And I think, the definition of whether we're in a wave or not is really more of a technicality. And I think we're seeing rapidly increasing cases at the moment, and I think we need to take action. I think you can't wait to see, are you in a wave or not in a wave? And I think this is something that we really, I feel, we should be moving away from, being so worried about, if it is the 4th wave. I think it is the 4th wave. And I think we need to we've seen very rapidly increasing cases. We had about a 2% positivity rate nationally kind of 2 weeks ago, and it's over 20% today. Gauteng, over 30%. We've seen 8,000 cases, today in Gauteng. So the rate of increase in cases is really concerning. I think, as others have said, I think it's too early to say whether this is going to translate into increase in hospitalizations. Definitely we're in a much better position now going into the 4th wave than we did at the beginning of the 3rd wave, where we had, really had only vaccinated the healthcare workers, and now we've vaccinated at least, I think just over 35% of our adults.
Dr. Groome, you mentioned action, and in the next segment we'll talk more about action then, a way forward in trying to manage this increase in the number of COVID-19 cases in the country. Let's park it there for now. You are watching In Focus on Newzroom Afrika, DSTV channel 405. My guest tonight, as we talk about the COVID-19 pandemic, are Nomafrench Mbombo. She is the Western Cape Health MEC. We also have Dr. Phophi Ramathuba. She is Limpopo's Health MEC, and Dr. Rolene Wagner, HOD in the Health Department in the Eastern Cape, as well as Dr. Michelle Groome. No shortage of doctors tonight. She's with the National Institute for Communicable Diseases. Remember, you can also send us your questions and comments. Do tweet us at Newzroom 405. That WhatsApp number again on your screen right now, 072 110 5584. Stay with us. Welcome back to In Focus. Tembekile Mkhototo in for Thabo Mdluli this Thursday. I'm still with the Western Cape Health MEC, Nomafrench Mbombo, and Dr. Phophi Ramathuba, the Limpopo Health MEC, as well as Rolene Wagner, HOD in the Health Department in the Eastern Cape. And from the NICD, we're joined tonight by Dr. Michelle Groome. Remember to tweet us your thoughts, your questions at Newzroom 405. You can also send us a WhatsApp on 072 110 5584. Let's come back to our guests then. And I'd like to pick up with you, MEC Mbombo, and talk about action. In speaking to the nation on Sunday, the president said we're keeping the country at alert level 1 of the lockdown. Do you think that's feasible, looking at the overall picture with infections?
Luckily for the 4th wave, we do have vaccination. In the previous waves, there were no vaccination. What needs to happen now is to push as much as we can, but not only for the health services, the responsibility from the health sector. It should be everyone, the whole of society. For example, in the Western Cape, with the whole population, it's only 50% of the people eligible, adults 18 plus, who have been vaccinated. Out of those, the 1.4 million are those who are 50 plus, and we have only vaccinated 59%. Whilst we might be appreciating that at least the over 60-year-olds were more than 60%, but we do know that the over 50s, once they are they are infected. These are the ones that who ended up having severe illness and also hospitalization and death. So it is crucial we vaccinate as much as we can. Because people often, they forget that actually the first line defense is about the non-pharmaceutical interventions, and now we've got the vaccines before you even think about the hospitalization. So that's where things are. Of course, with the news information, with the science, that does show that actually the gatherings and the closed environment where you find that there is no open ventilation, it does have a huge impact. This is December, and there are also matriculants who are jolling around, and then also we have got many people who have as many of the events, weddings, and all of those. So we need to be very extra careful because if it so happens that the vaccines, we don't vaccinate as much as we could, it means that the president might not have any other choice other than that we end up having a lockdown. We don't want to go up to that situation, because we do know that it does have a huge impact on the economy, that we also for health, it does benefit us, because as we know that when people at least are employed, they've got some means, it means that they could be healthy. So that's why we urge people, community leaders, the church leaders, everyone there, please assist in terms of the vaccinations. Yes, we take a responsibility where we go anywhere. It's no longer about now going to a facility to vaccinate or go to a community hall. We take vaccines to the people.
Let me come to you, Dr. Wagner. In the Eastern Cape, you're going to see a lot of traditional gatherings. It's the usual, the traditional initiation season where the young men in the Eastern Cape go perform the rite of passage and they return. Family, neighbors come together. Do you have a specific plan to manage those sort of gatherings, given that they're not outlawed by the lockdown?
Yes, thank you very much, Demikile, for the question. So our initiation, the customary male initiation season, opened on the 12th of November, and it will run through till the 12th of January. So the preparations that we normally have been adjusted for COVID. And so we work very closely with COCTA and with other social partners to ensure that the season is as safe as possible. So we've actually integrated into our normal preparations the COVID adherence regulations. So testing is available for all initiates. There's mandatory testing before they commence, as well as all of the,
everyone who's attending. And the people who are taking them through the process, am I right? The people who run the school.
Sorry, I thought there was an interruption. Sorry. Yes, so we do mandatory testing. We also offer vaccination, and then we have inspectors who go around to the initiation schools. We do have a challenge with illegal initiation schools. That is where our the deaths tend to come from, as well as the non-compliance with the COVID regulations. So there's a very active program in place to ensure that it is as safe as possible, but also implements all of the COVID and adheres to the COVID regulations.
Dr. Ramathuba, in Limpopo, you would usually in December have that mass Christmas service by the two ZCC churches. I know they've been closed for the better part now of the last 18 months. Is there a commitment for them to stay shut? And what are your concerns as we head closer to Christmas as far as potential cluster outbreaks and super spreader events?
I think we really need to be fair to our churches and all the religious gatherings, because they've been really compliant, and many of them had even invited us to their churches, including the two ZCC church, where we had vaccinated their congregants, so that they've even made it a requisite in some of the churches that if you are not vaccinated, you are not allowed entry into the church. And then I think it will be unfair for us to continue to say churches must close. And that's why we supported when the president kept us on level 1. And as the MEC Western Cape has indicated, when we go to all those extremes, we had no option. The only option that we had was to lock down so that the health system must be ready and we must focus on dealing with 19. Right now we have got the vaccines, and it is unfair for those who refuse to be vaccinated, and those who have been vaccinated suffer worse than even those who refuse to be vaccinated, because when you lock down the country, unfortunately it's all of us who suffer. even a cancer patient who has been vaccinated, it's denied the opportunity to get chemo and radiotherapy because the hospitals are only dealing with COVID. They are not dealing with any other medical condition.
Let me ask you, Dr. Ramathuba,
just
on the point that you were making about how unfair it is that people who may be vaccinated or suffering from other illnesses are now, shall we say, inconvenienced, put at risk by the unvaccinated. Would you be in favor of what's happening in Austria, for example? I know Germany has announced the same thing today where they're saying they need a lockdown for the unvaccinated. Is that where we need to go?
I think that's what we really need to go to, those extreme measures to say, if you are not vaccinated, you remember 2 weeks back as a province, we issued statement after the cluster outbreaks in the mines. Those who are not vaccinated, we can only advise you to say, stay at home, don't attend gatherings. Remember, your body is one of those that are factory hub for all these variants when they are being, the vaccine, the virus mutate and form them. So we have advised that to say, if indeed you know you are not vaccinated, maybe you should be one who stays and lock yourself and allow those who have been vaccinated to not to be denied that opportunity. We've seen what hard lockdown has done. We are now dealing with mental health issues as a result of hard lockdown. Hard lockdown was because we had no options. The current option is that we have vaccines. I think if we look at the trend of infections, what we are seeing currently, it's mostly the young people. I was trying to analyze all these cases. It goes mostly between 15 years to 34. And those are in majority. We are not getting those who are above 60 testing positive currently, or even forming part of the statistics of death, or even the few admissions that we have. They are not part of that. Why? You will realize that as a province, vaccinated more than 70% long time ago of the above 60. So those who are currently are being infected and spreading the virus, unfortunately, are the generation that even if you look at our performance in terms of vaccination, they are very low. We have not been vaccinating that age group. There's been a lot of vaccine hesitancy amongst them. And I think that is the only way that we need to go and put much more measures and encourage people to go and take up the vaccine, because even currently, with the increase of infection rates, we are seeing those who are vaccinated being really saved. Whether it's because...
Oh, pardon me, ma'am. Dr. Michelle Groome from the NICD, let me take the MEC Ramathuba's point about the low vaccination rates, I should say. Overall, less than 40%, I think, of our eligible population has had both doses of a vaccine, right? You've got people who still say they're not going to get vaccinated. So when you pair that with the fact that infections are rising, is a lockdown inevitable?
So I think it's too early to say. I mean, we would really hope that we can avoid a lockdown. At this stage, I mean, we've seen this rapid rise in cases. At this stage, you know, it's really early, and we need to wait to see over the next 2-3 weeks in terms of how this might translate into hospitalizations and deaths. Because I think, as others have said, it started very much in the younger populations, and in that age group, you've got much milder disease. They're less likely to progress onto severe disease. But I think we really would, you know, expect the vaccines to still work against severe disease, and we really need to promote this in our younger population as well, in terms of accessing vaccination. And I think there's a lot of, I think maybe complacency in that age group. They feel they're not vulnerable to severe disease and therefore don't want to be vaccinated. But we really have seen how, you know, this tends to be the age group that likes to congregate more, maybe than the older age groups. And I think that's definitely with Omicron. I think we're really worried with this, you know, increased transmissibility, potential immune escape. And I think we really need to use the measures we know. We know that if lots of people gather, the virus is going to transmit. And so we really do need to make sure that we limit, you know, these social gatherings, promote mask wearing, social distancing, and these are the things that we have, you know, used for previous waves. And now we have vaccination, and I think a lot of it is misinformation. And I think it's up to everyone to encourage those around you to vaccinate, to refer them, to people who can give them the correct information.
Doctors and MECs, let's park it there for now. When we get back, I want us to talk more about vaccines, the Omicron variant, and how then do we make the best of the remaining weeks of this year in South Africa. If you want to be part of the conversation, we're taking your views after this short breather. A reminder once more, you can contact us via WhatsApp. The number where you can send your messages is 072 5584. Suddenly couldn't read. You can also tweet us at Newzroom405. I promise you. Back to In Focus, another COVID-19 focused edition. We're dealing with a lot in the country. Just tonight, we've gone past the 11,000 mark. That's as far as the tally of cases that have been recorded in one day in South Africa. COVID-19 infections. We're hearing that our COVID-19 outbreak now is being driven largely by the Omicron variant. Various provinces doing their best to make sure that they're not in a position that Gauteng is dealing with tonight, where it makes up the bulk of infections with more than 8,000 of the 11,000 reported so far. But in a briefing earlier today, the Gauteng province was optimistic, saying that what it's seeing now as far as people who've been admitted to hospital with serious illness, this is far lower than what it was experiencing during the same period in the last wave in winter of this year. I'm joined still by my three guests, the Western Cape Health MEC, Nomafrench Mbombo, Limpopo's Health MEC, Dr Phophi Ramathuba, the Eastern Cape's Health Department HOD, Dr Rolene Wagner, and Dr Michelle Groome, the Head of Public Health at the National Institute for Communicable Diseases. I'll come to you all in a moment, but let's just take some of the messages that we're receiving from our viewers on In Focus tonight. You've got one now from Portia in Braamfontein, and she says, did people suddenly decide to flock to testing stations, and were the numbers collated? I feel we're being taken for a ride here. Something is not adding up. Let's see what else we have. T in Pretoria. T says, during the unrest, and especially during the elections, the number of infections was sitting at around plus 200 or so. Suddenly, the numbers are skyrocketing. Does the government cook the numbers for their convenience? And let me pick that up with you, Dr. Groome, from the NICD, because you deal with a lot of data. How much of a risk is the doubt that people have now with our COVID-19 data? How much of a risk, a threat is that to our response, given that the situation is becoming more serious with each day?
Yeah, so I think we were expecting another wave. We didn't know when that was going to happen, and I think for many it did happen sooner than we would have thought. I think we'd seen a large and quite protracted third wave. Up to a couple of weeks ago, we've seen really low positivity rates and low case numbers. And most likely this could well have started, during the election time. What we've seen before is that, it may kind of, there may be transmission almost, below the surface. And then, if there's one case, which then becomes two, if it slowly increases, and then we really only, detecting the higher case numbers once it reaches into the hundreds and thousands. In terms of the number of testing, definitely there is, different people test for different reasons. There's differential testing rates across the provinces, but the metric that we really find quite, good to use is the % positivity. And so this really is the number of positive cases, amongst those that are testing. And I think that's, is a really good metric to monitor. And this has been increasing rapidly over the last 2 weeks. I think, in terms of trying to manufacture these type of data, I think it really would be difficult. It's difficult to have 10 people in the room all to agree on something. And to try and have a nationwide conspiracy to try and generate, increasing numbers is really next to impossible.
Let me ask the two politicians then, Doctor, that we have with us tonight, MECs Mbombo and Ramathuba. You are politicians in your own right. You campaigned for your respective parties in the election. Are these numbers being cooked for your convenience? MEC Mbombo, you go first.
These are the results coming from the lab, which is a PCR test, and also there are those that are coming because the country added now the antigens test as well. So these are the real numbers. But noting what's happening now, which is just what I pick it up in most instances about ever since now there's this variant that has been mentioned, people just go for testing. And most of them is about they just want to double check because they're infected before. News is about even if they have been infected before, it doesn't mean you won't be infected because there's this thing about, let me just check because I was positive. I'm sure I'm not positive. If you will be positive, even again. So there will always be the reinfection regarding that. No, the numbers are not cooked. Fortunately, we've got one lab. I'm talking about the public now, which is the NHLS. They might have different branches. Okay. And then we've got the private labs. At the end, all these, they go to be interpreted via the NICD as well.
Dr. Ramathuba, we're going to perform a miracle tonight. DA and an ANC MEC, I expect to be agreeing tonight.
Yeah, I think the good thing here is that you are having politicians who are also health professionals. That is the advantage. You see, when the caller is asking whether all of a sudden testing stations have been opened, I think we need to clarify here. I think NICD tried to show you the reason for testing. This is how it works. I wake up, I've got flu-like symptoms. I go and test. The moment I test positive, I go and tell all my contacts. And my contacts would go and want to test. And some would have symptoms, some will not. Even though in public we might be strict about symptoms, they still do test. And then the more the people test positive, the more even others, as their contact, are going to be testing. So that is why now you realize there seems to be a vibe of people going to test. But truly speaking, even in observation, how many of your friends that you know are down with flu? I have got so many friends that have been calling me to say, I'm down with flu. So this correlates during election time. As we're campaigning Tembeki, we were not having those large numbers of people testing positive in our facility because they were not having those symptoms that will trigger them to want to test. So currently we've got people with flu who are triggered to go and test. And the good thing is that when this started, especially in Gauteng, it started mainly in our schools. And there is no way we go and use the schools to cook the numbers. And as MEC Mbombo has said, this is one NHLS. We have got nothing to benefit by cooking results. But it is important for us to risk communicate and give people honest information so that they can help us in return to curb the spread.
But Dr. Wagner, it does though, I mean, we speak about it somewhat lightheartedly tonight, I might suggest, but it is a real concern for how seriously people take your health messaging, public health messaging at this time if they do doubt the data. And I wonder if the Eastern Cape specifically is dealing with a lot of that and if there's a plan in place to counter it.
Thank you. So I think if one just thinks about it rationally, it's counterintuitive to cook the books. Because in cooking the books and trying to drive lockdown, it doesn't make sense for us as a country. I don't think our politicians and our president wants to go into a hard lockdown as before because that affects the economy. And the economy hurts all of us. So it's counterintuitive to want to cook the books to go into lockdown. I don't think that that's what we want to achieve. I think it's the myths that abound. It's remarkable. And I'm not sure what the origin is. But the way to counter the myths, it's actually really good that your listener raised that question with us. Because in raising these questions, and we can have an opportunity to address the rumors and provide facts to those questions and to those rumors so that we can correct those kinds of misunderstanding and beliefs in the system. So what we find in the Eastern Cape, what assists is just to be sharing information, to be as transparent as possible, to engage and communicate frequently to trusted leaders. And so our ward councillors, our mayors are very active, and our new mayor is now going to be part of a training and induction program with to give them information around COVID so that they can engage in an active way with the communities that they represent.
So let's talk then about vaccinations. MEC Ramathuba mentioned children and outbreaks that we're seeing at school level. You've got an issue where the youth in this country don't want to vaccinate. I'm wondering how keen parents in the provinces are to have their kids vaccinated. MEC Ramathuba, I'll start with you and then go to MEC Mbombo and come back to you, Dr. Wagner.
The issues of parents having difficulties with getting their children being vaccinated, it's also one area which how we managed to mitigate as a province was to work with the SGB and the MEC for education. We said, of course, let's allow them time to write exams and finish. Now developed a program when each learner will be collecting their reports. It will have a flyer there which is explaining, simplifying vaccination, why it's important the entire family to get vaccinated. And what we have seen is that once you educate the children and they got a buy-in, they are now forcing their parents to take them to the vaccination site to be vaccinated. And you'll find that the parent who was not vaccinated end up being vaccinated because the child will become your ambassador of the vaccine. And the other area of challenges was on the pregnant and lactating mothers. We have seen quite a number of them now testing positive. And because they have been mixed information in the past, people thought pregnant women should not be vaccinated because the information came later from the NDOH in terms of the guidelines for who, at what gestational age should pregnant women being vaccinated. So that information, when our midwives communicate to say at least you need 14 weeks first to be vaccinated after 14 weeks of pregnancy, and then later on we change that information. Of course, it at times have impact on the ordinary people on the ground. They still hold on the first information. So we are now coming up with a campaign of getting vaccinated as a pregnant woman to protect yourself and your unborn child, using the very same strategy we used when we started with our PMTCT, which end up giving us results of mothers who are pregnant, who are HIV positive, but give birth to HIV negative children because they would have gone through our PMTCT program. So even now, this is where areas there where we need to put up much more effort on our children now that they have done. Most of them are done with their exams. Also on the pregnant women, during their high-risk clinics, we are offering that vaccine and someone is there educating these mothers so that they don't fear anything about these vaccines. But otherwise, in general, the province, we still, the 2 days, the past 2 days, we were blessed by the presence of the Deputy President, who also, as in his capacity of chair of SANAC and also of interministerial on vaccination, had a dialogue with our community leaders, all our church leaders around the Wembe district, Chaban, where we had a challenge of vaccination. So we have been able to do that, to speak to the traditional leaders, traditional healers, and also the faith-based organization leaders.
MEC Mbombo, we're running out of time for now. In 30 seconds, only 510,000 teenagers and adolescents, that's 12 to 17, have been vaccinated nationally. That is not really a roaring success, is it, when you consider that there are millions of children in the school system?
Yes, indeed, it's true. But you see, it's a province per province will always prioritize. Whilst you might have a challenge in terms of that age group, like Limpopo, they've vaccinated almost all their senior citizens. So that's why they could be able to zoom much on the teenagers. For us, for the Western Cape, we still have to get 85% of the 50-plus-year-olds who needs to be vaccinated. It means by the end of December, about 640,000 of the doses that we need to provide. The other group, the 18 to 35, because we have got 4 universities, 32 campuses, TVET colleges, and also community education training that are here, about 2 million of the young people where we could be able to vaccinate. So for me, it's the above the 50-year-olds plus and the age group of the 18-35, because we've got universities, and some of them, they are in the residence, and also they are potential super spreaders. So for the children, we have vaccinated about 10%, which is about 65,000 of those.
Okay.
Yes, they are important, but for the province, for me, the priority is the over 50-year-olds.
All right, stand by. Next, I want us to talk about The issue that's got everyone hot and bothered, mandatory vaccinations. Who should sign up and who should not, or be allowed rather to opt out of that? That is coming up after this quick breather. Continue to send us your thoughts as well. Will you go ahead and comply with perhaps your place of employment saying that you do have to get vaccinated as a member of staff? And has that conversation already started with your HR department? Tweet us at Newzroom 405. You can also send us WhatsApps 072-110-5584. Let us know if you at your workplace or any other space have already been approached to talk about mandatory vaccination going into the new year. This is In Focus. I'm Tembekile Mkhototo in for Thabo Mdluli tonight. We're still talking about South Africa's COVID-19 crisis, at least building up to be one as we head closer to Christmas. 11,000 plus cases confirmed tonight. My guests are the Western Cape Health MEC, Dr Nomafrench Mbombo, Limpopo's Health MEC, Dr Phophi Ramathuba, and the Eastern Cape Health Department HOD. Dr Rolene Wagner. We're also joined by Dr Michelle Groome, who is the head of public health at the National Institute for Communicable Diseases. We're winding down our conversation, and we're still taking a look at least at some of your messages that you've been sending in via our WhatsApp line. You've also been tweeting. We've got one up now. If I could get it here. There we go. Tseho in Santon says, since some people do not want to vaccinate, why can't government give a booster shot to those already vaccinated? I personally believe nobody needs an incentive to look after their health. That's from Tseho in Santon. We've got time for one more. Matthew in Ulundi, KZN, says the number of cases we have up to now is scary, and the only way to fight this is to obey the COVID-19 regulations and get vaccinated, or vaccinate as many people as possible. Let's bring back our panel, and I want to pick up with you, Dr. Groome, the point about if some people simply don't want the vaccine, why not give boosters to those who want them?
Yeah, so that is a consideration. I think SAPRA had received, which is our regulatory authority, had received an application in terms of authorizing for use of the booster dose for Pfizer. And so that is under consideration, and we would need to wait for SAPRA obviously to authorize the use of the booster dose. And I think there are enough vaccines in country, and definitely booster dose would be considered, especially for those who are at highest risks. So we would want to boost the elderly as well as those with underlying comorbidities and those that are immunosuppressed.
And I don't want to ambush you here, Doctor, but there's new data out tonight from the South African Center for Epidemiological Modeling and Analysis, and they say that the Omicron variant has an increased risk of reinfection. And does that tie up with the data that you've been looking at, certainly?
Yeah, so I think I'm also part of that publication, and so what we've seen in previous waves, there wasn't really an increased risk of reinfection, but definitely with this new variant, we have been seeing more people who have been infected in previous waves who are now being infected again. And so this does point that this new variant might have some way to evade some of our immunity. But I think it is, we would really are keeping an eye on that, and we will know more in the coming weeks in terms of just with our laboratories and scientists doing additional tests, we will be able to find out more about this. But I think it is concerning.
So we're waiting to hear about severity of illness as well as vaccine efficacy.
Yeah.
Dr. Mbombo and all three of you, in fact, with the MEC Ramathuba as well as Dr. Wagner in the Eastern Cape, your provinces are all home to universities. We've seen already the South African Union of Students saying it rejects universities making vaccines mandatory. Where do you stand on that issue of institutions of higher learning which house thousands of people in your respective provinces, where students are saying they don't want to get mandatory vaccinations? I'll let you go first, Dr. Wagner, and then MEC Mbombo, and then I'll let you have the final word, MEC Ramathuba.
So I think it's always a difficult position to be in, because our country, given our history, is very conscious to be respectful of individuals' rights. By the same token, I think that many stakeholders are starting to reach the stage of saying that as much as you have the right to choose as an individual, when it impacts on public health, then perhaps we should be taking other measures that curtail your access to, curtail your movements perhaps, when it's going to be impacting on wider public health outcomes. So I think we, as the public sentiment seems to be moving in the direction of saying we respect your rights, however there should be limitations, because your rights can have an impact on the wider public. And so I think that's where we're moving towards as a government and as a province as well.
MEC Mbombo?
On Monday, I met with the vice chancellors and also the deans of these 4 universities. All 4 universities in the Western Cape, they've already going towards the mandatory vaccination, and they've undergone the whole process in terms of the submission and also the legal opinion. For me, and also remember, also these universities, also they provide their vaccination sites that they've initiated for everyone, not only the students that are there, but even the others from the outside. So when you have a situation of 20,000 plus of the students, and then they all gather 300 plus in one hall, some of them, yes, they could be able to do virtual, but the majority of them, they don't. But for me, I'm not more worried about the varsity students. I'm more worried about the TVET colleges and also the community education and training, because at least for them, they don't have such a resources. Universities have got even a higher health where they use the whole package, not only for the vaccination, but the whole package in access to the HIV/AIDS, to gender-based violence and substance abuse and all of those. So I do support for them that they are going to start the mandatory vaccination. And then we'll be asking the question, what about us as government? Because we already have the booster doses that have been provided for the healthcare workers who have been part of this Sonke. And also now there's been an introduction of for those who are immunosuppressed, so that we could have additional doses. At what extent that we start from our charity begins at home, healthcare workers, because we do have healthcare workers who haven't even started never used any vaccination. And even some of them, not necessarily in the public space, like the GPs in the private, they ended up being the influencers in regard for people not to vaccinate.
Okay.
So at what extent that we could be able to persuade those people actually to make people to vaccinate?
MEC Ramathuba, in less than a minute, you were speaking earlier about your frustration about low vaccination levels among the youth. Many of them are either going to university or already there. Their union says they should not have to be vaccinated under a mandatory system. Do you support that? And what plans are in place to make sure that the COVID-19 vaccine rollout lives in some way on campus?
I think when we started the vaccination for the public, as a province, we convened the higher health, also the higher education, which represents all our TVET colleges and our 2 universities. We met and we even offer to open fixed sites as the department, not even they themselves. We started with the 2 universities, and then we had satellites in all our TVET, because in our province, higher health is also there, where we roll out even ARVs through our satellite clinics in Tibet. Now, there's no reason why students can complain in terms of access of the vaccine. Secondly, when you are not in the shoes of the principals of these institutions of higher learning, you would definitely not appreciate the difficulty that they've gone through these past 2 years. And I think on that, one would want to support any institution of higher learning which makes it mandatory for learners to be vaccinated first, because our province is rural. Virtual learning has been very difficult. Network connectivity is a challenge in many of our areas, and we failed to resolve it in 2 years. We can't start resolving it in a month. So that is why when the universities want to open all our lecture halls and all our students must come and learn, some students blame virtual learning for failing. So the best way is for students to get vaccinated. And we are here as a department to support them and take them through all their fears of the vaccines.
MEC, we have to leave it there. We're out of time, but my thanks to you all. Dr. Phophi Ramathuba, Health MEC in Limpopo. Dr. Nomafrench Mbombo is the Health MEC in the Western Cape. We also have Dr. Rolene Wagner, HOD in the Eastern Cape, Department of Health. And, of course, Dr. Michelle Groome, head of the Public Health Unit at the National Institute for Communicable Diseases. My thanks to you all. Thank you so much for being on In Focus tonight.
Thank you.
Thank you.